Good noon. We're running after time. We're going over time. Warm greetings from Ateneo de Manila University. Um, I'm very excited to be among gynecologists and obstetricians this morning. Thank you, Dr. De Vera, for inviting me to be present today. I'm not sure how our obstetricians and gynecologists be more interested in talking about hepatobiliary resurgence, hepatobiliary malignancies, and application of HIFU. But I think it's very important because of the fatality of this disease. We have three experts to discuss some other indications of HIFU in the HPB system. We'll have the first one, without further ado, The Learning Curve of HIFU by Professor Him Min. Professor Him Min is the director of the Training Department, Engineering Research Center of Ultrasound Medicine. She is the senior HIFU physician, member of Youth Committee of Micro Non-Invasive Medicine and Chinese Medical Doctor Association. She is the senior training lecturer of International Micro Non-Invasive Medical Association. Let's welcome Professor Himin.
Good morning, everyone. So glad to here to share this topic. I think most of us are very familiar with the laparoscopy surgery here. Today we talk about another HIFU technique here. So maybe some of you are wonder how can we start? How can we learn this new technique? So what is a doctor learning curve? I think this is very important to us to know. As another professor before, they already talked about this principle of HIFU. As we all know, HIFU was guided by ultrasound imaging real time. So for this learning, it's totally different with the traditional surgery. So what is learning curve for for doctors? As we all know, if we want to familiar with one of the new technique, we must to know how to operate it. So how to evaluate if the doctor can do this surgery or can use this technique. We can always evaluate by this. The first thing that is the doctor can operate this technique independently, and then the next stage is the doctors can start performing more complex cases in a safe manner. And then the most important thing is can achieve the better patient outcomes. So for the high indications, different kind of indications, the difficulty of the treatment is totally different. So for example, for uterus, we talked about this morning. For the myoma, for the endometriosis, for CSP, or another indications. I think this is named two and another indication for breast cancer or for breast fibroadenoma. And the liver cancer, we'll talk later. Where the bone cancer, this is different indications means different difficulties. So how can we handle this? So what's the basic requirements for doctors who want to learn HIFU? For this technique, I think all the clinic doctors can learn. So that means the gynecology, they can learn. And for oncology, surgeons can learn. So breast surgery, they can learn. And so there are another factors or another requirements is this because we know this is totally guided by real-time ultrasound imaging. So we must familiar with the imaging. So this is a second requirement. And also we must know what is HIFU. So the understanding of HIFU is also very important. So for clinic doctors, what's the difficult for learning? As we all know, for gynecologists are very familiar with the imaging of anatomy and have strong ability in practice, but maybe not so familiar with ultrasound imaging. And for the radiologists, are very familiar with the application of the ultrasound operation, but maybe not so familiar with the clinic practice. So we, as a HIFU doctor, we must combine the clinic practice and combine the imaging together, so you can do it good. So what are the factors affecting HIFU doctors' learning curve? So the first thing, familiar with ultrasound imaging. This is the very important thing. You familiar with this, then you can see very clear. You can see where is the myeloma is the boundary, the location. So this is the first factor. And the second one is the clinical experience. That means how can you handle your patient combined with the clinic symptom and the treatments and how to handle it after this HIFU treatment. And the third factor is the HIFU treatments related all knowledge. That means how this works. So then this is same as the another learning. The number of cases you have done, the operation frequency also affects this. As we talked about this, Dr. Sandy learned this one spent 5 months, but some of our doctors only maybe take 2 or 3 months is enough. So what's factor was in fact the learning curve. The number of cases, the frequency, is very important too. So how to evaluate you have already can handle this. So the studication time, the treatment time, the empty visit, and also the most important thing is the safety. That means during your learning curve, during your treatments, if there is serious or major complications. So the safety is the most important thing. We have do a lot of learning or a lot of study about how to do this doctor training and so we separate this in two stages. The one stage is before 20 and 18 years before. And for that stage, we just learn, we just training our doctors one by one. That's just once we learn to one professor, we follow their surgery, we follow their treatments every day. And in that stage, the average learning time was 5.6 months. And the numbers, the cases you do is 50 cases. And then after 28 years, we establish a training system. With training system, I will talk later. And then we only need to 2.6 months. 2.6 months is here. And the average is 54 cases is enough. But according to my experience, especially after this 5 years, after this 5 years training experience, most of our doctors, they handle this technique after they do 30 to 40 cases. That's enough. If you have maybe for more than 10 years laparoscopy, myomectomy experience, maybe you can only 20 to 30 cases. That's enough. So the number of cases is here. So we do this learning and also the time. For example, the frequency is very important. If you, we just divided into two groups. The one group, the Dr. A, they only did 2 cases every month, and the other one, 7 cases 1 month. So it's take no shorter time for the doctor B. So why these all doctors each other, they take this whole procedure 2 to 3 months is enough because they do this every day. Just if you do laparoscopy, you do myomectomy, you do every day by day, maybe, yeah, it's a very short time you can have it. So this is the numbers. We treated for most of our in our hospitals here. So you can see for this years since 2009 and to last year, the numbers of the patients just increased. And for this situation, because of the hospitals are tend to use this technique more, and also they are not seeing it's very important to the doctors, more doctors this technique. So yeah, this is. So I will introduce this training system in China. In 2005, we have a high intense focus ultrasound tumor treatment training base in Chongqing. And this was established by Chinese government here. So since then, we do this training. Yeah. So in our training experience in China, yeah, we built our platform for simulated imaging to combine this clinic doctors experience and the radiologist experience together to shorten the learning time. And also we have a HIFU parallel system and combined with the real-time surgery and realize the one-to-many clinic introductions here. And this is our training system here. We divided into 5 steps. Now the first stage is 2 weeks basic theory training here. Mostly we can do in Chongqing or just in here. As we all know, then in the next 3 days, we will do a short training here. That's some of the lessons of these 2 weeks. And then we have 10 weeks clinic study. That means our doctors can go to the HIFU center to operate this treatment under the guidance of our senior doctors. And then as well, Dr. Sandy just introduced, we have our doctors to just go with you, just compare with you in the beginning of our center. So starts the treatment. And also we have telemedicine system to help us to assist this HIFU treatment. And in China, sometimes if need, we do some upgrade training here. So this is some of our lectures here, and some lectures we will start in this afternoon. And also, we establish some training lectures online. So if you are interested in, we can also learn this technique online. So you can see here, this is our training room here. For this one, this is for theory training here, and we have a system. This system is only for training, not for patients treatment. So if you come to Chongqing, you can use this system to practice. You can familiar with this system, and also we can some simulation treatments in Chongqing. And we set up some of this. You see, this is the liver experiments, and to help you to understand how HIFU works. And also, this is a simulated HIFU procedure here. Yeah, this is just answer myeloma inside, and so you can practice how to use this, how to treat it. And we want to shorten the learning time. So we established our image fusion technology here. We just immerse this MRI and the real-time ultrasound imaging. And then here we establish our 3D. So for the 3D, we can know the relationship between the organ, for example, for the relationship between the endometrium to the myeloma and the relationship of the uterus to the bladder. So this can make your treatment and make your learning easier. And here is the peritoneal operating room. So we have doctors to explain the whole procedure. And this procedure is the same time going on in Chongqing HIFU Hospital. So we can discuss, we can talk at the same time. And also, we can go into the operating room to learn. And the next day and the next 3 days, we do this too. And also, we established 26 clinic training in China, and 10 of them are international training centers. For all of the training centers, they already treated more than 2,000 patients here, so they have a lot of experience. So this is the whole training process: 2 weeks physical, 30 training, 10 weeks clinical operation training, and then after you finish 30 to 40 patients, so you can get your examination, and if you pass it, you can obtain the certificate here. So we also in medicine center here, I think now Dr. Sandy and Dr. Seva sometimes will use this telemedicine center to help to do some difficult cases here. So this is upgrade training in China. Every year we have one 3 to 4 times of this upgrade training, because as we all know, doctors are so good at learning, but sometimes during our work we maybe made some new difficulties, new problems. So we do this upgrade training and we solve the problems during our work. And since 2005, and we already trained about 3,000 patients, 3,000 doctors here, and 500 came abroad. Yeah, just in like you. Yeah, and I also have this clinic doctor team needed by Professor Zhang Lian, and our team are responsible for this clinic training and clinic support here. Yeah, this is our international doctor training system under this is here. So yeah, for this, you can come to Chongqing. You can come to Chongqing and finish all these treatments. Yeah, there is some of our doctors come to Chongqing here. Yeah, they learn this. They start in Chongqing. They start in the other HIFU hospital in other cities. And also we can go just like this. We can go outside, we can do abroad, we can do this training in your in your hospital here. So there is some of our training work in outside, and we also do some on-site training, online training here. So this is the last year. Yeah, this is supported in Dr. Seva's center here. Yeah, this is a great experience here. Dr. Seva's training base here, and say this is in Egypt. So we established this whole system. And what are we going to do is this, because as we know this the difficult, the indication is different, the learning difficulty is different. So we are going to do a doctor grading system later, and we also establish a training quality control system. So we just divided it into 3 grades. The first grade maybe just established in Chongqing, and the second grade is our training base. And then this is all of our HIFU hospital, HIFU centers all over the world. And every year we hold the training-based seminar to make sure all clinic protocol used in the world is the same, and we can control the safety and the efficacy of this technique. So your conclusion here. So for the clinic, for our doctors, after this 30 to 40 patients treatments, even including the junior doctors who just graduated from the medical school, after the 30 to 40 cases treatments, they can handle this. And the treatment frequency is also the main affecting doctors' learning curve. And the time, now if you are according to this whole training system, 3 months is enough. 3 months is enough. So this is my talk. This is my talk. Welcome to Chongqing. It's a very beautiful city. Thank you.